Hey guys, this is Jason from Hobo Forge Survival, and this week on Smart Tips and Tricks, we're going to be talking about med gear and patient assessment. Alright guys, we're talking med today, and we're talking about the med gear that I carry in any backcountry scenario or any type of adventure I find myself on. Me as a Special Forces medic for over 12 years, I understand the importance of carrying med kit and having it on hand because understandably bad things happen to good people, no doubt about it. The first thing we're talking about for massive hemorrhage would be any type of bright red arterial bleed from one of your extremities, arms or legs. So we're carrying a tourniquet of some form or fashion. All right, there's a lot of commercial tourniquets on the market. I think they're all of great use as long as they can shut down that bleeder. I've used many different tourniquets over my career. I just ensure that the tourniquet you choose and put in your kit you train with. Understand that all the gear I'm talking about today requires an element of training prior to going to the field, and there's no excuse for not preparing before you go into your backcountry scenario. So tourniquet being first and foremost. Attached to that bleeding, we may not need a tourniquet because it may not be arterial bleeding, but we still have an injury that requires some attention and bleeding. So next thing I have in my kit is some hemostatic gauze. And hemostatic gauze is a gauze that has a clotting agent inside of the gauze, which helps to clot, helps your body, aid your body in clotting that bleeder. So you pack that down inside the wound, and then you put some pressure on top of it, essentially creating a pressure dressing, and then you're able to stop that bleeding. So inside here we have hemostatic gauze, we have some gauze, and we have some Cobam, which is just an affixing, non-adhesive affixing tape to help lock that down. Here we have some scissors, and that is to actually expose the wound so you can get a good eye on what you're looking at and treat that wound. Here we have a couple cravats, or just large bandanas that I can use to help tie down that dressing that I've put over top of that wound. I can also use these to isolate bones in a fracture scenario, maybe sling up an arm if we have some type of fall on outstretched hand or fouche injury, which tends to be the #1 cause of injury in the backcountry, would be some type of musculoskeletal injury due to a trip or a fall. In here we have a couple pair of gloves when dealing with any bodily fluids, any blood, anything of that sort. We should go ahead and put some gloves on our hands. And that kind of takes care of the massive hemorrhage aspect of things in the bulk of this med kit. And then you have hypothermia. Inside this kit we have a space blanket here, and that is to ensure we have something to place over top of the patient to keep the patient warm, okay? Especially in patients that have lost blood, they have a higher incident of hypothermia due to low blood volume, and it's absolutely essential to keep a patient warm in a scenario like that. In addition, from a psychological standpoint, when somebody's covering you up, keeping you warm, talking to you, making sure you're okay, from a psychological standpoint, that makes you feel better. Therefore, you're going to feel better about the situation, even if the situations may seem very dire. So take care of the patient, keep them warm, make sure they're good to go. Next to that, over here we have just kind of your ouchies, some Band-Aids, some blister bandages for blisters, and some large Band-Aids. Essential to carry, can stop small bleeds, no issue there. And then we have a marker, and this marker is to annotate any diagnostics you may take on that patient prior to evacing the patient, because any type of medical information you can give them, pulse, respirations, unconscious versus non-unconscious, detriment in level of consciousness, person, place, or time prior to evacuating them out. All that information gets passed up to a higher level of medical care and will help them treat the patient. Now this med kit was given to me by my buddy Sam over at Twin Hawks Survival or Twin Hawks Outdoors, and I think I've only added a few things to it that I felt were relevant, but fits in your pack, quite small, a great med kit to carry with you. Understand whatever you're choosing to carry, train with it, because that's exactly what you're going to fall back on, is your level of training in a high stress scenario. So that wraps up med kit and what I carry and why. Again, I encourage you to seek out training with this equipment and pack your med kit accordingly, and ensure everybody in your group has their own med kit. If you've liked this video, please like and subscribe, and see you on the next one.